We left the central nervous system, and we're starting the peripheral nervous system. And at the end of our last lecture, we talked about some aspects of the peripheral nervous system. So we're going to slightly back up a bit and cover some of the rest of that as we transition into the periphery. So that's kind of the shoulder region between the central nervous system and the peripheral nervous system. And this is really where we need to pick up. And this is with reflexes. Okay? Now, keep in mind that the central nervous system and then connecting to the periphery, we have sort of these convenient nomenclatures that we use to compartmentalize what's by definition the central nervous system and what by definition is considered the peripheral nervous system. But it's not as if, when you leave one system and enter a new system that it's all that obvious. So the analogy that I would use is, how many have done a road trip in the States? Okay. Really? Sing the hands again. All right, that's better. Some of you just were not, your hand was frozen or something. So road trip in the United States, you're on an interstate, right? By definition, it's a roadway between two states. And you leave one state and you enter the other, and on your GPS, it's like all of a sudden you're like, oh, you're now in New Mexico, or you're into Colorado. And then at some distance later, you know that you're in the new state because there's a welcome to this state sign. All right, colorful Colorado. Or the land of enchantment, I think, is New Mexico's. Right? So when you're traveling in the United States and you cross over into a new state, it's really indistinguishable from where you just were, right? I mean, even the topography, the landscape is, it still looks pretty much the same. It's not like magically it changes. You get into Colorado, but when you transition into Colorado, that first little segment doesn't look really anything different than the Arizona that you just left, or the New Mexico that you just left, or the Utah that you just left if you're coming over from Utah. Right? It takes a little time before you get into the Rockies, or first you hit the San Juans if you're driving from here to there. And then if you get far enough north, you get to the Rockies, and then you start seeing postcard-looking Colorado. Right? Well, it's similar here, is when we leave the central nervous system and we get into the periphery, there's not even a sign. Okay? It's as if there was no sign. The signal that's being sent doesn't really know that it's in a different part of the nervous system, as we've described it as being the nervous system. So I just want to propose it in that concept, just a little bit outside of the box thinking. We're in a new chapter in the peripheral nervous system in the textbook, so all of a sudden now it's a totally different unit. But the signal hasn't changed. It's the same action potential, right? You still have all the same things we just learned about. Our resting membrane potential is still at minus what? 70 millivolts, right? Threshold is reached at about minus 55, right? You still have a positive deflection, and then you have this hyperpolarization that takes place. None of that is any different. It's not like you lose the terminology of local potentials or gradient potentials, and you got to come up with some new term, right? They still speak English in Colorado and English in Arizona, right? It's the same language that's being used. So the action potential language is still the same. So as we back up just a tad and we talk about reflexes, I thought I would bring this, and some of you that are type A personalities, you know who you are. You're a little stressed because it's out of sequence right now. You're like, oh, okay? Right? I mean, you guys, if you have a label maker in your dorm room, how many of you have a label maker in your dorm room? Seriously. Really? Is it labeled label maker? So you don't forget. Somebody really liked that over there. So if you are a type A and you need to label stuff, this is out of order. I get it, and it really bothers you. But there's a reason for it, is I want to remind us where we've been. So we're over here in the central nervous system, and we're going to be here now in the peripheral nervous system. And we're kind of in our transition between the spinal cord out to the periphery. So there should be kind of like a dotted line that sort of moves it out of the CNS and into the periphery. And if we look at the periphery, we're going into our sensory and our motor divisions, just like what we saw in our central nervous system. And if we look at our sensory division, and we're going to talk a little bit more about this in the future here, and we look at our motor division, they're divided into visceral and somatic. So today we're going to talk about somatic and visceral types of responses in our peripheral nervous system. And we characterized this a while back as visceral, another name for it being autonomic nervous system. And only have one fly in because I want you to still be able to see that this one is, what this word is, because you can draw a line here and say, okay, or a line here saying, other name for this would be autonomic nervous system, like this fly in. So when you look back at your notes, you remember. If this was a diagram that we had in our central nervous system lectures. If it doesn't show up on your lecture right now, you can flip back a couple of lectures and find it. And so our autonomic or our visceral nervous system is going to give us information about things that we don't have to think about. And I'm going to give two specific examples of reflexes today that are from our autonomic nervous system. We're also going to talk about two very specific somatic reflexes. Somatic reflexes. And somatic is just a term that means a body cell. So it could be any body cell. And in today's context, this somatic reflex is going to be at the level of the muscle. So we're going to talk about the muscle spindle, and we're going to talk about the Golgi tendon. And so I wanted to help you categorize where we are. Also, as part of our review, I thought I would pose this question. And this question would be total fair game on the fourth exam. A type of question that you might see, because we still haven't completely finished up the central nervous system and entered into the periphery. So I would really encourage you to think about these types of questions as you study for exam 4. So in this question, it's posing, the left postcentral gyrus receives information about the texture of a fabric. Texture of a fabric. You're touching with your hand. If the left postcentral gyrus, right, on the left side, right, is receiving information about, is it sensory information or is it motor? It's sensory information, right? And you're touching it with your hand, but which hand are you touching it with? The right hand if it's going to the left, right? So if it's coming from the right hand, your right hand, along which spinal nerve did this signal enter the spinal cord on its way to the brain? A, B, C, or D? A, B, C, or D? How many of you say A? How many of you say B? How many of you say C and D? Or E? Those are the ones that maybe you don't want to play, right? How many of you aren't playing this game? Okay. Well, I think you want to think about this. So the correct answer is A. Why? This is the right dorsal, right, ganglion that comes in. Dorsal is posterior, bringing in sensory information. It's coming in from the right side because the information came from the right hand. You know it's the right hand because it ended up going to the left postcentral gyrus. Okay? We call these types of questions tertiary questions. Now, what the heck does that mean? There's a whole science and field about how to write test questions. Okay? And there are belief systems that multiple choice questions are really easy tests to take. And if you want to make a difficult test, you actually have to do essay or short answer style tests. Do you guys agree with that? No. I don't either. I think you can ask complex level of thinking in a multiple choice question, and this is an example of that. Maybe you thought exam 3 was an example of that. You would be right. There were some challenging questions in there that are tertiary, meaning there's like 3 different levels. For example, you first understand how to answer this question, have to know that the signal decussates. Right? What does that word? Maybe you don't remember that fancy word, but what does that fancy word mean? It crosses over. Right? Now, where does it cross over? At the medulla. That's not in the question, but I could have written a question about that. right? Based upon this information, why did you choose your answer to the previous question? Do you guys remember that style of question? Okay? So this is the first information that you need to know to answer this question is that the information comes and crosses over. Secondly, you need to understand that it's coming in because it's sensory, because that's fabric that you're touching, right? So now you have sensory information. Then the third thing is, where does sensory information go? It goes to the pre or the post central gyrus. Post central gyrus. So that's 3 pieces of information that you need to be effective in answering this test question. Now, not every single question on the exam is written this way, but there are a few of them that are, right? You guys saw those or walked into them in this last exam. You're going to see more of those on the next exam. We're kind of mid-semester, we're hitting our stride, and this is where the challenging nature of the class comes in. So I wanted to take a moment using an example question to show you the way that I think when I write test questions. They're not all primary level questions, right? What's the definition of anatomy? Okay? What's the definition of physiology? There's some warm-up questions, but then there's some meaty questions like this one. They're secondary or tertiary level questioning. You guys following what I'm trying to explain to you? Okay, so given this, let's take a peek at our reflex. Now, a reflex, there are really 4 things that are primary requirements of a reflex. 4 what we will call main characteristics. Number 1, they're stereotypical. They essentially occur in the same way every time. This information is not on the slides. You probably want to write it down. Stereotypical. They occur in essentially the same way every time. Number 2, they're very quick or rapid. They don't take a long time. Number 3, they're involuntary. You do not have to think about them. They happen automatically or autonomically. And then lastly, but not least, there's no order to these. They need stimulation. There has to be an input in order for them to fire. You go to the doctor, they're checking your reflexes. They strike your knee with a mallet. That's the stimulus. Right? Someone yells your name in a crowd, and you reflexively turn and look. Right? So you're using what brain structures when you do that? The corpora quadrigemina, right? You have superior colliculi and inferior colliculi. Okay? So 4 main characteristics. This would be a very nice warm-up type of test question. Which of the following are not a characteristic of a reflex? Make sense? You want me to repeat them? Okay. Stereotypical. They're quick or rapid. They're involuntary. And they need stimulation, or they need input to respond. Now, if we look at the components that are shown on this reflex example, and the reflex that we're showcasing is at the level of the muscle. And we're going to talk about this specific example here momentarily. But what we've got, if we start here at our extensor muscle is being stretched. Okay? The extensor muscle is being stretched. And so that means you're extending the leg. And the leg extensors are being stretched. And that stimulates this sensory receptor, known as a muscle spindle. And we'll look at that in the next slide. But for now, just know that it's a sensory receptor. And if you open it up, this is just a slice down the midline. You can see sort of the internal components. This is normally not opened up like this. It kind of looks like a fish's mouth. It's actually just the casing is opened up so you can see what's going on inside. But you have a primary afferent neuron. That's this yellowish gold neuron that's coming in. And look at that. Lo and behold, it comes in the posterior or the dorsal aspect. And it's coming in this example, from the right side, which is a terrible drawing because it's showing the patient's left. Did you notice that? Okay. So I would critique this for the editor and put a little line here and say, this really is a poor drawing. She should be sitting over here, and you should be showing the right muscle leg extender. But let's ignore that and let's give them a little grace. This is still accurate. This is coming in the posterior aspect, which is sensory. And now you've got these alpha motor neurons, right, that are going to be stimulated. You've got interneurons that come right back. The interneuron comes right back and stimulates this blue pathway. And this blue pathway are these inhibitors, right? I'm sorry, these are these, what is this blue pathway? This one actually is the inhibitor for the flexor muscle. And this one right here on the red one is the stimulator for the extensor muscle. Right? So you inhibit the flexor and you stimulate the extensor. Well, you also send a signal back up to the brain. So our components are the sensory receptor, the afferent neuron that comes in the back aspect or the posterior aspect, an interneuron that connects it right back out as the reflex, and also an interneuron that takes it up to the brain. And then you have to have an effector organ. And in the case of this example, the effector organs are our flexors and our extensors. This is an example of a somatic reflex because it's skeletal muscle. Now, later in the lecture, I'm going to talk about examples of visceral reflex. And because the visceral reflexes control things of the abdomen and the thoracic cavity, usually it's either smooth or cardiac muscle rather than skeletal. Okay? So let's take a peek a little bit more actively at the magnified view of this muscle spindle, which is a sensory receptor, part of this reflex arc, in the example of a somatic reflex. And what this is doing is basically controlling or giving you feedback about where your leg is. It's a protective mechanism. It is giving you information about how the muscle is changing in length. So why would that be important, right? Why would that be important is if you're going to kick a soccer ball, okay? You're going to kick a soccer ball and you flex your quadriceps muscles in order to extend your leg, right? And you flex them too aggressively and you hyperextend your lower leg and break it, that's not good, right? You'll have one kick per leg, then you're done. Okay? So instead, as you come through to kick, you actually have feedback that's telling you exactly the lengthening of that muscle fiber. And the same thing exists on the hamstrings. And we've all been there. We all know we've done an activity, you're like, oh, I went too far on that one. Right? What happened? I just overdid it. Okay, I hyperextended or I strained my muscle. So in that example of that injury, your muscle spindle was not giving you feedback quick enough, or you were ignoring it because you're distracted, okay? Or you're just getting old, okay, frankly. Welcome to the club. So the muscle spindle gives you information about changes in muscle length. And we've got a couple of different types of fibers. You can kind of see from the picture that they're innervated with afferent fibers, primary, secondary, as well as gamma motor neurons. And that's inside in here. So the primary afferent and secondary afferent are sensory fibers, right? Afferent. So the primary afferent fiber is giving you information about what's happening inside the muscle spindle. Remember, you see, it's almost as if that this sheath, these two are brought together and connected, and then someone took a scalpel and just ran it right up the midline and opened it up. It's like gutting a fish, okay? And so you can peer inside. It's not filleted open like that in our muscles. It's actually encapsulated, and it kind of looks like, have you ever been to the beach and you find like a piece of seaweed, and they have like these roundish or kind of these spindly like corpuscles? And the kids like to walk up and go, hey, look, Dad. Right? You know what I'm talking about? Yes. So that's kind of what it looks like. It's kind of like a little, it's fat in the middle and kind of spindles out like this. It's called a muscle spindle because it looks like a spindle. And then these structures that are inside are giving it real-time information, giving you real-time information about what's going on. So the primary afferent fiber is responding or picking up information about the rate and the amount of the stretch of that particular fiber. The secondary afferent fiber is giving you information about the magnitude of the stretch. So rate, right? Rate suggests an amount per unit time, or the frequency. And the secondary afferent is giving you information about the size or the magnitude, how much force there's actually being generated. Okay? The gamma motor neurons, these gamma motor neurons that actually come in, they're going to allow for activity to take place. So they help to adjust and maintain the sensitivity of the muscle spindle. So with training, your spindle becomes either less or more sensitive, depending upon the training specificity. And so as you practice that soccer ball kick, right, you get more used to that motion. Your muscles loosen up because they're more familiar with the fact that that sensation is going to happen. You have a more fluid motion, right? It's actually more efficient. It's faster. It's smoother. And the internal mechanistic afferents and efferents adjust to that. And it's the motor, gamma motor neuron inside that actually is adjusting the sensitivity of your internal sensory receptor. So that's what's going on inside. We also have stuff that's coming from the outside. We have extrafusal muscle fibers. And the extrafusal muscle fibers are shown up top here. Right? These extrafusal muscle fibers are stimulated to contract by what we call alpha motor neurons. These guys were the gammas. These guys are the alphas. Okay? So the muscle spindle, in summary, is a inside the muscle sensory receptor that's giving you feedback about what's happening at the level of the muscle. It's kind of like on your car. If you look, there's actually a number of dials on the dashboard, right? I know you only pay attention to the one that, goes from like 0 to 120, right? That's the only one that you watch. But there's all sorts of other dials. And some of them are giving information about oil pressure. Some of them are giving you information about the temperature of your engine, right? So that's what these guys are synonymous with, is inside sensory receptors giving you feedback about what's happening. And the feedback is knowing how the muscle's being stretched or changes in muscle length. Now, the second example of a somatic type of reflex is the Golgi tendon. The Golgi tendon is a proprioreceptor. A proprioreceptor is one that gives us information about what? Location in space, okay, proprioception. It's going to give us information here specifically about muscle tension in that particular location. So it's giving you position in space, meaning muscle tension at that particular phase of your gait cycle, as the leg moves. Or as the leg moves to kick the soccer ball, where is the tension the greatest? Where is it the weakest? Okay? That's also part of the training. So think about, did anybody go to Taco Bell this morning for the free? Really? Did you guys know about? I totally went to Taco Bell and got a free.
Crunch Wrap.
What's it called?
An A&P Crunch Wrap.
Crunch Wrap. Yeah, it was actually pretty good. Okay. I actually not allowed to eat for the rest of the day based on calories, but the Crunch Wrap was actually quite good. So I had a free Crunch Wrap. You guys, I think it ended at 9, so bummer. But in the World Series, right? You know where this came from? There was like a stolen base marketing gizmo that Taco Bell did, and I don't even know who. I probably should know who stole the base. I didn't watch this particular game. Stole the base, and then Taco Bell sponsored free breakfast AM Crunch Wrap. Thank you. AM Crunch Wrap for the entire nation. It was nationwide this morning. So I was crunch wrapping with like everybody in the U.S. And it's estimated this is NPR, but it's estimated that this marketing campaign will cost Taco Bell $10 million. So I'm just helping Taco Bell, you're very welcome, them to get the most out of their $10 million because I had a really nice AM Crunchwrap. Thank you. Taco Bell. Okay. Thank you to our sponsors. Don't worry, we're not going to talk about baby Jesus or anything like that, but you guys don't know where that reference is? Talladega Nights, baby. All right, what was I talking about? Hang on, I got to think. Proprioceptors. How's that related to an AM Crunchwrap? Oh, I know, baseball. That's what made me think about it. Baseball. So the baseball player, not the guy that stole, but the pitcher that was asleep when it happened. That pitcher has a wind-up and a throw, right? And he is an elite athlete. There's no ifs, ands, or buts about that, right? And so the activity of the Golgi tendon, want to bet that pitcher on your favorite baseball team, right, knows exactly how much tension is throughout the entire wind-up and throw and release. Or how about another one? How many of you are racket players? Racquetball, tennis, squash, anything with a racket. Okay? Golf, it's a modified racket. Golf. Okay? How about baseball or softball? Or how about any sport with a ball? Awesome. I'm trying to get for maximum audience participation here. So if you're involved in a craft, let's say you're a musician. How many musicians and athletes do we have in the room? And fans of literature. Okay? That should be everybody. So if you are interested in any motion type of activity, you think you're actually somewhat okay at it at times. You know, if you're playing a piano piece, okay, if you're playing a stringed instrument, you know exactly how much tension is necessary in order to perform that craft. And that's what's happening with the Golgi tendon. It's giving you feedback about the tension, right? We just recently had a piano tuned in our house. And I am by no means a masterful pianist, but my mom's a piano teacher, so my brothers and I had to play the piano, whether we liked it or not, and most of it was not. But we played regardless. She's this 4'11" captain that was in our house. Okay, that's the height of my mom, not the size of the piano. And so we didn't have a choice. But this piano that was out of tune, the other thing that I was noticing about it is the keys just felt wrong, right? If any of you play an instrument and you know that there's some feedback that's coming from, as the piano, the action of the piano, the ivory keys will push back every time you depress it. And as you push down different pedals, you're going to get a different feel. If you play a stringed instrument, you know maybe when those strings, like the guitar, these strings, I need to replace them. You're like, they look like strings to me, they just don't feel right. What are we talking about? Right? The quarterback that asks for a new ball, let's pretend it's inflated correctly. Right? It doesn't feel right. Okay? Even the referees knew, right? The referees knew, something's not right with this ball. It doesn't feel right. Okay? All of you have a bike, you ride a bike. My brakes need adjusting. You're getting feedback about how the tension is. And that's all part of the Golgi tendon in your muscles. So these are proprioceptors. They're convenient placed. Here's the muscle fiber. It terminates into the bone. Here is the femur, right? The neck of the femur. And there's this muscle fiber bundle. It's kind of like pulling a ponytail together on hair. And as it's surrounded with a sheet, it dives and inserts into the bone itself. And this is the tendon. This is the tendon. And the Golgi tendon organ is sensory receptors embedded within that tendon. That makes the most sense if that's where they're going to be. So when they're stimulated, they're providing feedback about the tension of that muscle. So that also gives you an understanding of not just where it is in space at that particular amount of tension. It's also giving you feedback about when you're going too far or when you should back off. Okay? So it's another type of protective mechanism in some cases, but in a lot of cases it's just giving you that proprioception of, yep, that pitch, that felt like a good one, right? Or you're at the batting cages and my swing feels good today. Or, you know what, I played well today, I could just feel it, it worked, everything was kind of, you know, organizing. I was turning the pages in that book like no other. So if there's an extensive amount of tension, it's a heavy page, right? There's feedback that inhibits motor neuron activity, right? And that's actually where you go, oh, right? You stop with that throw or that motion. You say, okay, that didn't feel good. Something popped or something, you know. You're getting, the popping isn't the tendon organ. The popping is probably ligaments or tendons around, or maybe the tendon itself is popped. But you're getting tension feedback about what's happening. So this is our second example of a type of feedback mechanism. And so here is the image that hopefully you have. You guys have this image? No. Yes, okay. So the Golgi tendon that's located here, right, is giving us information. It's coming in to the posterior aspect, right, and it sends out two signals. And let's pretend, for example, that it's sensing the change in tension, and it's going to send out a negative response, which is in red, and it's going to send that to the quadricep extensors, right? Because the quadricep extensors are trying to extend the leg, right? And it's putting a lot of tension here, so it feeds back with this negative feedback saying, turn off. It's time to stop contracting. Simultaneously, this interneuron sends another positive signal, the purple line, to your hamstring or your flexor group. And so what it's doing is, it's kind of taking the foot off of the accelerator so that you don't continue this motion, and then it's putting the brakes on by flexing these guys so you actually bring it back. Make sense? So you're sending two signals in this feedback loop, one that goes to the organ that needs to shut down, the muscle, and the other one going to the antagonist so that it pushes it in the opposite direction. Yes?
Is this specific tendon like on every part that goes from a muscle to a bone?
Yes.
Okay.
You have these tendon organs on every bone. As you know how you studied in lab these insertion and these origins? That's where all these tendon organs are located.
So every single one of those.
Every single one of them is going to have a tendon organ or a component of a tendon organ to give you feedback of where things are. Okay? So, two examples of somatic reflexes. Now let's shift gears. Now we're going to talk about visceral reflexes. Visceral reflexes. These guys are unconscious. These guys are automatic. You don't have to think about them. They're stereotyped as well. They happen much slower. And they also happen involuntary. They happen involuntary in the sense that you don't have to think about them. They just occur. And there's two examples that I'm going to show. The first one is called the baroreceptor reflex. And you got to bear with me a second. I've got to go to this link real quick. And the second one is what we call a mituration reflex.
Blood pressure stretches the carotid arteries and aorta, causing the baroreceptors to increase their basal rate of action potential generation. Action potentials are conducted by the glossopharyngeal and vagus nerves to the cardioregulatory and vasomotor centers in the medulla oblongata. As a result of increased stimulation from the baroreceptors, the cardioregulatory center increases parasympathetic stimulation to the heart, which decreases the heart rate. Also, As a result of the increased stimulation from the baroreceptors, the cardiovascular center decreases sympathetic stimulation to the heart, which decreases heart rate and stroke volume. The vasomotor center decreases sympathetic stimulation to blood vessels, causing vasodilation. The vasodilation, along with the decreased heart rate and decreased stroke volume, bring the elevated blood pressure back toward normal. If the initial problem were a decrease in blood pressure, the activities and effects of the baroreceptors, cardiovascular center, and vasomotor center would be the opposite of what is illustrated.
Okay, so the take-home message on these, and I'm going to show you one more, is that we've got a way to interact between the periphery and the central nervous system, right? And we have these reflexes that are showing how we utilize these two unique pathways and how we blend them together. So this video, the way that it was describing things, is we've got this visceral, automatic. You don't have to think about it. But when you're monitoring your blood pressure, you monitor it using sensory receptors, not in the muscle, skeletal muscle. It's in essentially smooth muscle of the wall of the blood vessel. And it stretches. And when it stretches too much, it knows that the blood pressure is too high. And if that blood pressure is too high, it sends feedback, right? This glossopharyngeal nerve hits the medulla oblongata, where you have cardiac regulatory centers. That's what we just learned. It sends an output via the vagus nerve, which is another cranial nerve, right? These are two different cranial nerves that you learned about in lab. This innervates onto many different places, and I'm going to show you here in a minute how the vagus nerve goes all over the thoracic cavity and the abdominal cavity. But one of its termination points is in the rhythm centers of the heart. And you'll learn more about those in 202 when you talk about cardiovascular. So these rhythm centers within the heart are stimulated to slow down. And as that slows down, the pump doesn't push as much, and that lowers blood pressure. So this is a reflex arc, and so the way that the central nervous system and the peripheral nervous system are organized, they're organized, we see in two examples somatically, with our muscle spindle and with our Golgi tendon. And we see now with one example, we'll see a second one with the maturation reflex, but this is called our baroreceptor reflex. Baro meaning pressure, right? What's the barometer reading today, which is what's the air pressure? So baroreceptor is a pressure receptor that's found within the carotid arteries, okay, of the neck. All right, so the second one that I want to show you is
the micturition reflex involves impulses traveling from the urinary bladder to the sacral region of the spinal cord and from the sacral region of the spinal cord back to the bladder. It is coordinated by neurons in the spinal cord and can be influenced by signals from the brain. When the urinary bladder becomes stretched, there is an increase in the frequency of action potentials carried from the bladder wall to the sacral region of the spinal cord.
That's sensory
In
input.
response, parasympathetic neurons from the spinal cord to the bladder are activated.
That's
and
motor
this
output.
causes the smooth muscle on the bladder wall to contract.
Right? And then you pee right away.
The sensory signals to the sacral region of the spinal cord also stimulate ascending pathways to the pons and cerebrum, which results in a conscious desire to urinate.
And if it's not appropriate, then
If urination is not convenient at the time, the brain sends impulses down the spinal cord to inhibit the micturition reflex. Impulses carried via somatic motor neurons keep the external urinary sphincter contracted, which also prevents urination.
Right, that's this.
When urination is desired, signals from the brain stimulate the micturition reflex. The brain also decreases action potentials in the somatic motor neurons to relax the external urinary sphincter.
Okay. So, this works super well when you're potty training. I find that if a 2-year-old understands the mechanism of the maturation reflex, then it makes it much easier to potty train. Okay, so just keep that in mind. Food for thought for later in life. But the idea about this kind of goofy example, hopefully you won't forget about it, right? Is you see this reflex arc that's happening. And you see this reflex arc that's saying, okay, stretch of the bladder comes right back to contract the smooth muscle so that it expels urine. But fortunately, there's another signal that goes to the brain, right, which happens to be some learned behavior where you have to pay attention to that signal. And then that output back to the bladder actually says, okay, let's inhibit the smooth muscle. That's why, if you've ever been on this road trip and you're like, I really got to go, okay? That's always me, right? Like, men cannot hold it nearly as well as women, I've discovered, okay? Times 5 in my house. So I'm always one like, is anybody got to go? Just looking out for you. Anybody got to go? Dad, just pull over. We know you got to go. So, you're on a road trip and you got to go. Well, if you hold it, you can fight through it, and then it goes away, right? You're like, oh, I don't have to be anymore, right? And then you pass, as soon as you pass the exit, it's like, oh man, I really got to pee again, okay? Because the stretch signal comes back, and it sends that signal to the brain. You're like, I really got to go, right? Well, you can do that a few times, and then you're sort of dancing with danger, in my opinion. But the brain is sending the signal down to the bladder, saying, okay, let's contract that sphincter, right, to prevent the flow of urine, and you're inhibiting the smooth muscle from contracting. So an autonomic reflex that you don't have to think about because urination will just naturally occur. And if you have a puppy or when you have kids, you'll realize it just happens, okay? But we can modify it and train it. So a lot of the autonomic or visceral reflexes can be overridden and under conscious control. In this classroom, hopefully, there's 376 examples of how we've done that, right? You're all potty trained, I'm assuming, okay? Now, let's take that to our baroreceptor reflex. Okay, what about this whole field of biofeedback, Keller? Like, what about the ability to slow heart rate by thinking about it? Can you do that? Of course you can. Can you control autonomic reflexes consciously? Well, all of us have learned how, socially, to control this one, right, the maturation reflex, so it doesn't mean that we couldn't control others. All right, as we move on in this lecture, out of our 2 and 2 examples, so 2 examples of somatic, 2 examples of visceral. Visceral is under autonomic control, no question about that, but it doesn't necessarily mean that you can't override it, right? And potty training is a perfect example of that. The peripheral nervous system, we now need to look at the autonomic division, and that's kind of back to that flow chart that I was showing you. So if we look at our autonomic division, it's a busy slide, I get that, but it's actually pretty straightforward. We have 2 main branches. We have our sympathetic branch, and we have our parasympathetic branch. Our sympathetic branch is activating things for fight or flight, physical activities. Increases heart rate, increases blood pressure, increases respirations or breathing, increases blood flow to skeletal muscles, and it decreases perfusion to the digestive tract, and it decreases perfusion to the skin. In our parasympathetic nervous system, this is dominating by rest and digest, or calming type of activities. Calming type of activities. So it tries to reduce energy expenditures, and it, what we call, supervises or oversees digestion and waste elimination. So a clinical example of the parasympathetic dominance is in a geriatric patient population, and the challenge of what we call mode commode, or commode mode, right? So when you are going to the restroom, right, and you're eliminating waste, this is a parasympathetic dominating activity. And so in patients that have a heart condition, we teach them, if they're sitting on the toilet and they're going to the bathroom and they are bearing down, it can be dangerous. Okay? So if they're pushing aggressively, then they're increasing their parasympathetic outflow, and that can actually drop heart rate. And they can actually pass out, have a heart palpitation, while they're actually trying to go to the restroom. Okay? So this kind of commode mode is sort of an example of how parasympathetic activity definitely is supervising waste elimination. Both of these guys are active at the same time. They're active at the same time. But what ends up happening is one is probably dominating the other. And the autonomic tone of all of our muscles is stuff that's taking place by these two nervous systems that is this background rate of activity. It's a background rate of activity that's always on. And this picture over here is showing you kind of the different subdivisions that we're going to pull out here in a second of the sympathetic and the parasympathetic branches.
Why is it that sometimes you scare an individual and they can't take themselves or like miss themselves?
Well, so if someone is scared or spooked, why would there be waste elimination spontaneously? Well, a lot of times because those sphincters that are being controlled are under automatic control, they get overridden by sort of this, sympathetic activity. So, okay? But maybe you shouldn't be scaring your friends like that. That's kind of a mean trick. All right, so if we look at the sympathetic nervous system, the SNS, sympathetic nervous system, we also refer this to as it's referred to as the thoracolumbar division. The thoracolumbar division because the nerves that come out of the sympathetic nervous system actually move out of the lumbar region as well as the thoracic region. So the adrenal medulla is a structure, and it is the dominant structure of the sympathetic nervous system. It sits immediately above the kidney, so you have two adrenal medullas. And it's really a modified sympathetic ganglion. Remember, a ganglion, what's a ganglion? It's a bundle or a collection of nerve cell bodies. And this bundle or collection of nerve cell bodies that sits just above the kidneys will secrete compounds that primarily are responsible for our sympathetic fight or flight. The first one's referred to as epinephrine, abbreviated epi, also referred to as adrenaline. That's a clinical term. And then the second compound, which is slightly less potent or effective, but still effective, is called noradrenaline. Noradrenaline, otherwise abbreviated norepinephrine. Both of these are what we call sympathomimetic drugs. Sympathomimetic drugs are drugs or compounds that stimulate the sympathetic nervous system.
As per his question, laughing until you pee yourself, the same concept?
Yeah, same concept. Laugh until you pee yourself, so don't be overly funny with your friends too, and don't spook them so they poop themselves. Okay. These adrenal medullas, work directly with the spinal cord. So the kidney would be down here. These guys sit right on top, so they're kind of like, they look like a mountaintop as they sit above the kidney. They have a cortex on the outside, and they have the medulla on the inside. And this medulla is what's responsible for manufacturing epinephrine and norepinephrine. When the sympathetic ganglion, the motor ganglion, comes out and stimulates the adrenal medulla to release the epinephrine and norepinephrine into the circulation, that's what floats around the bloodstream and hits different target tissues. Okay, so if you've ever been spooked, okay, or if you've ever woken up in the middle of the night to like a fire alarm, or maybe it's just you wake up every morning to your alarm clock and it scares you, and you wake up and then it's about 2 or 3 seconds later you start feeling your heart racing. It's because it takes a little time for these guys to make it to the circulation and then make it back to your heart where it actually has activity.
Is that why epi is used as a regulatory for in surgeries and things like that when things start going?
Yeah, so the question is, when things start going south in surgery, they start getting bad, and you start to lose the patient, they'll deliver a dose of epinephrine. That actually kickstarts the heart, right? It raises the heart rate because it's a sympathomimetic drug. That's exactly right. Okay? So, the adrenal medulla. If we contrast the sympathetic nervous system with the parasympathetic nervous system, so if we go back 2 slides, and we look at where the sympathetic nervous system exits out with these different neurons, we've got colored in blue and in sort of orange. All of these nerves are coming off of the thoracic or the lumbar spine. So that's the thoracolumbar, right? Here, here with the parasympathetic nervous system, we actually see that they come off of the sacral region and the cranial region up top. So we call this the craniosacral division. And everything in between is really where all the stuff off of the thoracolumbar division actually perfuses, or innervates. And if you look at some of the known cranial nerves, right, craniosacral, look, here's cranial nerve 10, which is known as the vagus nerve. Look at all the different things. I promised to you, when we introduced the cranial nerves, that we weren't going to memorize them all, like you did in lab. We were going to touch on them where they show up. Here they're starting to show up. We just talked about the vagus nerve as part of the baroreceptor reflex. That's cranial nerve 10. Remember in that example, the outflow of the vagus nerve slowed down heart rate. And that should make sense. This is a parasympathetic nerve that's innervating the heart to slow down heart rate. You with me? So cranial nerve 10, the vagus nerve. We also have the glossopharyngeal nerve that was in that example. Cranial nerve 9, right? And that actually has innervation to the parotid or the salivary gland. That should make sense, right? If you want to get ready to digest a meal, you're going to start to release digestive juices from your salivary glands. And that's the glossopharyngeal nerve that stimulates that activity. Right? We also have our facial nerve 7, right? That stimulates tears, nasal secretions, as well as salivary gland activity. Cranial nerve 7, or the facial nerve. That should make sense, because if you increase the moisture in the nose, you make the nose more sensitive to smells. That's getting you ready to eat. Why do you start to cry? I'm not sure. Okay, but the tears are probably there because there's a lot of lysozymes that are protective of the eyes, that mucous membrane. And I've seen college students eat. Sometimes you want eye protection because the food just like that. Okay. So vagus nerve, glossopharyngeal, facial nerve, the oculomotor nerve that narrows the pupil and focuses the lens. If you're getting ready to eat, you're doing stuff right here, right? You're looking at your food, you're into it, right? Foods are flying, you got your protection of your eyes, okay? Fluid juices are flowing, you're digesting your food. We actually have sort of a third independent system that's known as the enteric nervous system. The enteric nervous system is a subdivision of the autonomic nervous system, and it is under control of the sympathetic and the parasympathetic nervous system. It's kind of the other category. But it actually can act independently of those two systems all by its own. That's why we kind of usually put it in its own category. It directly controls the gastrointestinal system. This is a cut through, this is the diaphragm, and this is the esophagus coming down as it's coming towards the stomach. And once it leaves the stomach, it comes out into the intestines. And the enteric nervous system that dominates GI activity has about 100 million neurons in the wall of the digestive tract alone. And this is what's responsible for GI motility. So if you're ever sitting there, right, after a meal and you're like, your stomach kind of goes, right? Or you hear like these little, right? Or before a meal, you're like, my stomach's growling, right? That growling is the motility starting to be stimulated, giving you information of, I want something in here, okay? So, 100 million neurons acting essentially independent, giving you signals about what's happening within the GI tract. Its duties are to regulate motility and secretion that happens within the GI tract. Now, how do we put some of these concepts together? Well, the anatomical orientation of the sympathetic nervous system kind of looks something like this. It's busy. Here you see these ganglion, which are these collection of cell bodies that exist outside of the central nervous system. And we've got the ability to send these different signals in a widespread manner to different locations within the body. And it's organized kind of like a distribution network. And so what I'm going to characterize here are 3 different pathways that give us a widespread effect. And so what I want you to be able to appreciate from this particular slide, which is code word for what do I need to study, is what's circled in red. How's that for focusing your energies? So what's circled in red is you've got this splanchnic nerve, and this splanchnic nerve, that's going to, all of this is motor output from the sympathetic nervous system. Motor output coming from the anterior aspect, so that makes sense. This one is going to use this splanchnic nerve distribution pattern to bifurcate or send signals in all sorts of different directions. And it sends it to things like the liver, the spleen, the adrenal gland, stomach, basically the visceral organs of the abdomen. Kidneys, urinary bladder, reproductive organs. If we follow this track up top, this track comes around like this, circles, does this little, on-ramp, and comes up here. And this one is the sympathetic nerve. This is sending things basically to the upper chest. Ooh, that was weird. The upper chest and then to the head. So it's going to be like the iris, the salivary glands, the lungs, the heart, the thorax itself, the esophagus, vascular elements within the chest cavity. And then our third category is what we call our spinal nerve. Comes out here, spinal nerve sends things out to sweat glands, piloerector muscles, blood vessels, skin, and skeletal muscles. So these 3 different sympathetic pathways are distributing basically to the entire body. You with me? Now, if we look at the anatomy of the parasympathetic nervous system, we see some slightly different orientations. We actually see with the parasympathetic nervous system that we've got orientations that are more structural, like architectural. We've got what we would call a long presynaptic axon that's going to travel to a terminal ganglion. And then we have very selective stimulation that takes place. So for example, if we look at this next slide and we look at the architecture or the way that these 2 pathways are oriented, we can see that this orientation gives us a myelinated fiber going to a skeletal muscle. And at the gap or the synapse, we're using acetylcholine to stimulate onto our effector organ, our muscle. In this particular example, which is autonomic, we actually see a very short preganglionic fiber that's myelinated. Then we have a middle synapse with acetylcholine, which is like this one. And then we actually change to an unmyelinated fiber, and we can actually use slightly different neurotransmitters. We could use either norepinephrine or we could use acetylcholine. So we get some differences in the different pathways. We've got this one which is monosynaptic, meaning only one synapse. This one which is polysynaptic, meaning many synapses. We actually have acetylcholine exclusively used in our somatic efferent innervation, and in our autonomic efferent innervation, we actually have acetylcholine used first and then a choice. So this is a slide that kind of shows us we actually have some variety that can take place between the different ways that these arcs exist. The homework that I want you to work on is comparing and contrasting these 2 different pathways. Okay, I really want you to spend some time, and we're not going to do it in class, you're going to do it on your own time. But when you come back next Tuesday, I want you to be able to tell me, okay, what are things that characterize a somatic reflex arc, and what are things that characterize a visceral reflex arc. Now remember, the somatic reflex arc, we're not done yet, guys, so just do it quietly. The somatic reflex arc is dealing with what examples that we talked about today? Which ones?
Golgi tendon.
The muscle spindle, very good. And another one? The Golgi tendon. And the autonomic, right? The automatic, what are some examples that we talked about today? Remember the peeing reflex? Like this one, the urge to pee?
Blood pressure.
And blood pressure, very good. So as you think about this diagram, and you ask yourself this question, this table is what is going to be super helpful. So look at this table real quickly in the closing moments. Okay? Somatic information is on the left and autonomic information is on the right. The effectors of somatic, skeletal muscle, Golgi tendon, muscle spindle. The effectors of autonomic, like the cardiovascular, regulatory, blood pressure, and smooth muscle of the bladder. This is usually voluntary. This is usually involuntary. This one uses a nerve fiber from the CNS to an effector with no ganglia. That's this picture. This one uses two nerve fibers to an effector with a sympathetic ganglion. That's this bottom picture. Do you understand how you use this information? If you finish this out, the neurotransmitter is always acetylcholine. This one uses acetylcholine as well as norepinephrine. This one is always excitatory, and this one can be either or, excitatory or inhibitory. If you cut the nerve, and this is fascinating to some students, you cut the nerve surgically, this will lead to what we call flaccid paralysis. Flaccid means a word that is limp or unable to contract. So it's paralyzed in a non-contractile state if you sever the nerve. If you sever the nerve over here, it becomes hypersensitive, that organ, that tissue. So please take some time, because this is where some of the material gets a little challenging. Please take some time comparing and contrasting those two different types of reflex arcs. Have a nice week, and I'll see you Tuesday.
Lecture is not on.